job. Like,
well, she has to medicate.
to me, that's very impressive.
No, I mean, she's in a situation where she has to, you know.
Yeah,
and one of the things that I think also that I see as a difference is that I am not minimizing fibromyalgia at all. I think you both are, all of you are courageous. So I don't have to deal with that awful continual pain. My mother does, my husband does. I think you all are heroes. But I think in the scientific community, there is a lot more acceptance that fibromyalgia is a real deal, and chronic fatigue syndrome is just all in your head and you're just depressed.
Yeah, I mean, personally, what I've seen clinically, and you know, I'm seeing the patients after the diagnoses. I think they're part of the same genetic family, and I'm seeing that it's part of the same genetic family because I believe honestly that my mom probably started off with like Epstein-Barr and it progressed to whatever. I mean, I don't know. I've seen, but you guys have all valid points, and there's people with fibro that have valid points. As I've seen people swing both ways. I've had people who've done physical therapy who have found exercise, yet they don't have all the muscular pain, but they're still wiped out. Does that make sense? But it may not be to the extent that you guys have felt, because I know when I dealt with people with chronic fatigue, walking for 20 minutes, you're out for 3 hours. Does that make sense? You know, or just even getting up in the morning and stuff like that. So everybody has a different way of kind of processing it, I think, and it's a challenge. What's the biggest challenge for you guys every day?
Well, I was exercising. I was walking my dog every day, and that was my yay. And I went to visit my mom, and now I'm just, you know, I moved furniture and things like this, and I'm just whipped. And so I can't get into any of those healthy ways right now.
Yeah. Okay. Yeah, sorry. That's a bummer. How about you? What's your...
Mine has just been debilitating fatigue for 20 years, even though I've done all kinds of fancy, you know, work with fancy doctors and stuff for the last 6. But it's not, I'm just exhausted all the time. I don't ever have a good day. Like, I don't remember ever feeling rested for like 25 years. But then there's worse days than others. Like, there's days like today where I drove, she gave me a ride. There's no way I could have driven. And I would be back in bed if I was at home because I'm uncomfortable, I'm exhausted, I'm kind of queasy. The only way to get another chance on my day and be able to do anything is if I get like 3 hours more sleep after sleeping 11 hours last night. So it's just always this battle, and like, am I going to be able to do anything today? Because I work for myself at home, and I only make money when I can work. Anyway, it's just, you know, and I've done all the hormonal, like all this tidal bomb stuff. I've done so much stuff, and it hasn't really changed my quality of life.
Maybe you'll hear more answers as we go through the rest of the presentation.
Yes.
I understand. I'm with you guys. And
well, he asked what the difference was.
No, it's good. It's good. And we're on the team.
Yeah, no,
we're really trying to find answers because it's been dismissed. So on that note, when we talk about the clinical exam, it's still traditional, you guys. The doctors are still using, for at least fibromyalgia, they're still using the history of chronic pain more than 3 months, widespread pain, and those tender points. Did you guys all have that in your exam where they touch the neck and the elbows and the hips? Okay, that's what they kind of do, and they usually go through and they just push in if 18 points or more are tender, then that means you're positive, and then they try you on a dose of medication.
They've actually changed that in 2011. They changed the diagnosis.
They were trying to, yeah.
They didn't actually do it?
They haven't yet.
I thought they took away the tender points.
It hasn't, you know, they're trying to. The American Academy of Rheumatology proposed it. Wolf, his name's Wolf, and his research group, they did a bunch of questionnaires, and they said, well, these questionnaires can work the same as the musculoskeletal, you know, the tender point exam. But then there's a lot of doctors who haven't adopted that yet and said, well, wait a second, I still got a whole group of patients coming in, and they're flared up all the time. So yes, I can do that, but how are we going to take care of that? So I think that there's some value to the tender point exam for other clinicians, massage therapists, chiropractors, physical therapists, because the diagnosticians, they're going to go straight to where? Pharmacology. They usually go straight to the pharmacology. But for us manual therapy practitioners, we're not tapping into the whole community yet.
Mm-hmm.
You know, we don't really know how much massage works and what else we can do. I mean, there's so many things, you know, Feldenkrais, there's so many movement therapies and stuff that we can do. So that's the big thing there. But that's the traditional thing. And what's interesting is with fibromyalgia, the general muscle skeletal exam, neurological, and laboratory tests are all normal. That's the key thing. So as of even to this current day, those three criteria are the only norm referenced research diagnosis. And there's a couple questionnaires that they use. But all the other blood tests, labs, and everything comes out normal. So that's why in the medical community there's such a divide of them saying, hey, this is kind of like a sham wow, you know, or, you know, this is kind of like true. And so, but now we're getting more and more doctors, even orthopedics. Usually the orthopods weren't against it because I work with a big group of them. A lot of my spine guy believes in it wholeheartedly. He's like, yeah, you know, and so.
But they're not running the right tests. If you go to naturopaths, I've been working with naturopaths for
Correct.
6 years. I mean, so you know, they're not running the right tests, which is why they're not finding anything. You know what I mean?
And the other problem is the laboratory tests have very wide ranges, and that's the biggest problem.
Well, and depending on the lab, they have their norms.
Yeah.
There's not a national norm reference, and so when they're looking at like your, you know, creatine kinase, and they're looking at all these tracers for tissue breakdown and inflammation and all that, there's not a standard definition of that. So yes, yeah, we can get all deep into the testing and stuff, but again, a lot of these people they're not running the right thyroid tests. They're not running these labs.
The hormones.
Yeah, they're not just running, or they're just not just running just simple dietary stuff. You know, we haven't even looked at diet yet, you know, and diet's a big part of it too, you know, because, you know, all the junk we eat, all the processed food. So there's a lot of things that are going into it. The good thing is the funding's there now, because we're starting to get some traction with the standard medical community and stuff. So, okay? And the only thing I also too is that I thought it'd be an interesting, I put the website for you guys. Dr. Cheatham, he has a protocol. It focuses on sleep, hormones, infection, nutrition, and exercise. And he's an internist, and I don't know if he's going to have a cure or not, but he claims that there's a good approach.
He's a genius.
Yep, he's very good at what he does.
Ava's a very strong follower of him.
Oh, good. So you know what I'm talking about. So you know I'm well versed in the world. And so he used to have it. And so if you guys get a chance, check out his website. He's got a video that he presented at a professional conference. One of my physician friends was at the conference, and so I think it's an integrative medicine conference. So I think that's kind of interesting to look at. And then when we talk about what medications we're prescribing, just remember that the 3 main families, or 4 families that they give, may have some more side effects than what we always remember. As far as like antidepressants, pain relievers, sleep medications, and muscle relaxants. Those are the common big drug families that they give, but you guys have to remember that a lot of these medications, they also have secondary side effects. And with these secondary side effects, that can affect your exercise levels. Does that make sense? Especially if they're trying to mask the pain. And I think that's the big thing is a lot of times when we talk about just fibromyalgia and the muscle discomfort, you know, or the fog or the cognitive, we take these medications to try and keep us functioning, but they may mask some of the stuff. So if you go and have a vigorous workout, when these medications are peaking, we call it the half-life of the medication, it's peaking, then you could be more sore later. So that's one thing we've had before too, is that we've had people who are starting to work out, or we give them a basic program, and they start to exercise a little bit harder on the medication. Does that make sense, you guys? Okay.